My name is Vail Karuppiah. My position is a consultant orthopedic surgeon with interest in foot and ankle surgery. Good question. I did ask myself a lot about this question many times in my life, I must say. I wanted to be an engineer. I was interested in building things. As time went by, I did a lot of voluntary work, and I had a personality to have more human touch. And I thought I did enjoy more in doing things that involve more treating humans. And hence, medicine fell into place. Engineering background is the reason for my specialty choosing, I must admit. When I was an intern housemanship, I got introduced to orthopedics through plastic surgery. Playing with tools and wires was always my thing. I always was good in carpentry. And that's purely why I decided to do orthopedics. And when I did orthopedics, as time went by, you have to subspecialized, then feet, and anything below the knee becoming more exciting. Again, going back to my engineering interest, feet is more creative compared to most other subspecialties, and hence I fell in foot and ankle service. The most rewarding time definitely is when the patients are happy. You can have a bad day, things might not go well, but if one patient comes back and say, I'm better because you've done a surgery, or my life is easier now, that definitely is the most rewarding part, and that can't equate to anything else. My patient value most about my openness. I don't hide things. I don't put anything under sugarcoat. I say what is possible and what's not possible. I don't give expectation which is not able to achieve. I think the openness makes it easy for them to understand the diagnosis and come to a conclusion what will going to happen after the surgery. And another thing is, I tell my patients things as they are, but I'm also very cheerful most of the time. Good days or bad days, I try to keep the ambience good for them and keep them in a good mood. Maybe those two characters makes it easy for me to work. Don't know whether it's a mantra, but definitely I tell all my juniors one thing: you have to treat a patient as a wholesome. Although I only do feet, I'm only an orthopedic surgeon, but I don't regard myself as that, because all patients don't come with orthopedic problem, necessarily have orthopedic problem. They might have something else going on, medical problems or personal life problems that might reflect on your surgical outcomes. So I try to give a bit of time to understand what actually the patient wants. And sometimes I am right, they're not there just for orthopedic issues, they've got other issues. And when you touch that a bit, it makes your outcome better, or sometimes you can avoid doing unnecessary surgery as well.